Hello and welcome to the Charlotte campus fourth year course overview. I'm Dr. Heather Tarantino, Charlotte campus director and assistant dean. I am excited to share with you the many learning opportunities that you will have here on our campus. First, let me tell you a little bit about our campus. We are Atrium Health, Carolinas Medical Center, located in the center of Charlotte. We have 40 residency and fellowship programs, as well as many allied health profession students from our 2 colleges of health sciences and local programs. We are also the Level 1 Trauma Center and Quaternary Hospital for the whole Charlotte metro region. Charlotte is a growing, vibrant, diverse city with lots of art, culture, and outdoor activities. We can offer you not only the greatest learning opportunities in the hospital, but all the excitement and activities that you wish for outside of the hospital. At this time, I would like to introduce you to Dr. Michelle Birch, our Director of Academic Services.
Hello, I'm Dr. Michelle Birch with Atrium Health, Carolinas Medical Center. We're so excited to have you. We have over 70 fourth-year course offerings spanning 14 different departments. And we'll go ahead and take you to the emergency department right now. In fact, I need to call them anyways to let them know one of my patients is coming.
Oh, hey, Dr. Birch, how are you? You're in clinic? Okay. Oh, you have a stroke patient coming in. Okay, last known well was when? 30 minutes ago? With right-sided deficits? All right, we'll make that a code stroke. Thanks so much for taking the time to call us. Okay, bye-bye. Hey, I wanted to let you know about a code stroke that's coming out. Coming in 5 minutes. Last known well was 30 minutes ago, and they have complete right-sided deficit. 5 minutes out. Okay, sounds good, thanks.
Evaluating acute stroke patients is just one of the things you'll be doing on your fourth-year rotation with us here at Carolinas Medical Center. In addition to being a stroke center, we're also a chest pain center, the only Level 1 trauma center in the region, and the largest children's hospital between DC and Atlanta.
Wouldn't it be great to actually practice seeing a simulated patient before you actually saw a real one? If you're interested in how a simulation curriculum works, how the logistics are involved in making a simulation curriculum, then the simulation elective would be the right one for you.
Hey, Dr. McNeil, I just took a radio call. There's a helicopter coming in, motorcycle crash, Level 1 trauma. I'll be here in like 5 minutes.
Okay, let's go get set up.
Yeah, sounds good.
Can somebody please call trauma?
So students going into emergency medicine or trauma surgery have the opportunity to enroll in the helicopter EMS rotation with MedCenter Air. And doing so, you can fly with the helicopter crews doing critical care interfacility transfers, as well as high acuity medical and trauma scene calls. You'll also have the opportunity to ride in the ground ambulances and quick response vehicles and help provide care for some of the sickest trauma and medical patients in the out-of-hospital setting.
Quiet in the room for the trauma. Let's get started with our primary survey, Dr. Wares.
Airways clear, breath sounds are clear bilaterally with good chest rise and fall, skin warm, normal color, 2+ radial pulses bilaterally.
Let's get the patient on the monitor.
2+
Chest x-ray and pelvis.
bilaterally.
All right, let's go ahead and get a fast exam, please.
Hi, Dr. McNeil. How
Dr.
are you?
Steve,
What's
so
going
good.
on?
So good to see you. This is a young woman who was in a motorcycle accident about 25 minutes ago.
Okay.
Fast is positive in Morrison's pouch. Lots of free fluid. I also see free fluid in the parasplenic region.
Okay.
Sounds like she might need the OR.
Yeah, ma'am, are you having a lot of abdominal pain?
Oh yeah, don't touch me there.
Okay, sounds like I will be going to the operating room. I'll just give them a call right now. Hey folks, I'm Gaurav Sachdev. I'm the surgery clerkship director at Carolinas Medical Center. I'm a trauma surgeon, an acute care surgeon, and we're really excited for you guys to join us next year on our campus. We are the largest trauma center in the state, busiest, and we're a tertiary academic center that has a huge referral base. And so we have all the specialties here for surgery, including advanced hepatobiliary, surgical oncology, minimally invasive, robotic surgery, advanced urology, plastic surgery, cardiothoracic surgery, peds cardiac surgery. So we have the whole spectrum of excellent surgical subspecialties for an academic medical center. And one of the highlights here is that our faculty are very excited to teach and include medical students in the operating room with hands-on experience. We have a wonderful low faculty to student ratio, so you will get one-on-one attention. And we have excellent surgical residents who are always highly rated for including medical students and getting them involved, preparing them well for internship in whatever subspecialty you may choose. So please consider us and join us next year. We look forward to having you here. Thanks for listening.
Now that you've had a chance to see our busy emergency department, let's go take a look at all of our other specialties.
So hi, my name is Kimberly Blasius. I'm one of the rotation directors for the anesthesia rotation. Whether you're looking to do more anatomy or physiology or learn something from intubations or other cool procedures, we're the rotation for you. Welcome you to join us. Reach out if you have any questions. I'd look forward to hosting you soon.
Hi there, I'm Darryl Klotz. I'm one of the physicians at Charlotte Eye, Nose and Throat, and we are your host for your 4th year ENT rotation. This rotation can be customized among our many subspecialty offerings within ear, nose, and throat. We have over 40 providers and we cover all of the subspecialties. Whether you're a 4th year student interested in ENT as a career, or you're a 4th year student just looking to hone your skills in ENT, this 4-week rotation really balances the in-office diagnostic abilities and also focuses on showing you the breadth and variety of ENT surgery, whether it's fine microsurgery of the middle ear or some of the complex anatomy and head and neck surgery. And to wrap up, we really hope that you choose ENT as one of your 4th year rotations, and we look forward to seeing you.
Hi, my name is Dr. Adeline Dozwa, and I'm the course director for the Global Emergency Medicine elective. This elective is open to 4th year students in the spring of their final year. When you enroll in this elective, you'll have the opportunity to learn about how emergency medicine is practiced in a low resource setting where the specialty is still relatively new. This is accomplished through a 4-week field experience in Dar es Salaam, Tanzania, where you'll be shadowing alongside Tanzanian emergency physicians taking care of patients with a variety of diseases. You'll also have several pre-departure briefings covering topics such as introduction to global health, basic tropical diseases, the healthcare system in Tanzania, and safety and security in the field. I look forward to hearing your questions about this elective.
Hi, my name is Dr. Benel Perkins, and I am the 4th year internal medicine clerkship director. In this role, I am in close communication with the students as they do a variety of internal medicine rotations, most notably their acting internship, as well as their medical ICU rotation. In addition, they have great opportunities to do subspecialty rotations. In their acting internship role, they usually come to the hospital roughly around 7 o'clock in the morning, and in this role, they take on 4 to 5 patients, and they act like the major caretaker of that patient. They are providing themselves an opportunity to plan for their intern year in their subsequent year of 1st year residency. They manage the patient, communicate the plan with their attending as well as their residents, and do all the day-to-day tasks that are necessary to manage their care in this acute setting. In the medical ICU rotation, they are able to take care of patients even in a higher level of acuity care, and they thoroughly enjoy this rotation. They have many opportunities to do intubations, to do central line placements, and to do all the things that entail taking care of a patient that is fairly sick. The great opportunities that they also have here at CMC are to rotate on a variety of subspecialty rotations. In this opportunity, they can rotate on cardiology, immunology, rheumatology, pulmonary, gastroenterology, hematology, as well as oncology, and a wide array of many subspecialty opportunities that we have here at CMC. So we welcome you and we hope you enjoy your rotations.
Hi, my name is Erin Crane. I'm one of the gynecologic oncologists, and I'm currently the 4th year clerkship director for medical students rotating through the Department of Obstetrics and Gynecology. One of the great things about our department is that we have a lot of high volume on labor and delivery, so medical students get to catch lots and lots of babies when they come on to service. We also have very busy surgical subspecialties like my personal favorite, gynecologic oncology, but also urogynecology. Our current electives that we offer students are reproductive endocrinology and infertility, urogynecology, gynecologic oncology, maternal fetal medicine, and gynecology. The rotations that tend to be more medicine-based include maternal fetal medicine, where students and physicians are dealing with high-risk patients and high-risk pregnancies, but also reproductive endocrinology and infertility. For students who are more interested in surgical experience, we make a very big effort to get y'all involved when you're on service with us in gynecologic oncology and urogynecology and gynecology as well. I think historically we've had really good feedback from students and they enjoy coming on our rotations because we make every effort to get them involved and have them with us in clinic, seeing patients independently, getting them surgical experience, and experience delivering babies on labor and delivery if that's something they're interested in.
Hi, my name is Larry Kempton. I'm the Orthopedic Surgery Course Director for fourth-year medical students. When you come to Carolinas Medical Center, there's a large variety of patients that you can see with musculoskeletal issues. Students who are interested in going into orthopedic surgery as a residency and career will typically do a rotation where they spend 2-week blocks on 2 different subspecialty services and spend a lot of time both in the OR and in the clinic. Students who are going to be doing residencies other than orthopedic surgery have the ability to tailor their rotation more towards what their own interests are. This may be spending some time in the emergency department, this may be spending some time in the outpatient center, and that can be combined also with some time in the operating room. Seeing a variety of patients through different subspecialties is also a possibility. So if you're interested in orthopedics, then contact me and my assistant, and we'll look forward to seeing you in Charlotte.
Hello everyone, my name is Dr. Amish Shah, and I'm a pediatric gastroenterologist here at Levine Children's Hospital at Atrium Health. I'm the site director for pediatrics and would love to invite you to come join us for rotations here to learn more about the field of pediatrics. Whether you're choosing a career in peds or just want to learn more about it, this is a great place to learn and train. We have been lucky enough to be ranked in 8 different specialties by US News and World Report. We have an enthusiastic group of residents and attendings who are willing and ready to teach medical students. Please consider joining us to learn anything about cardiology, infectious disease, intensive care, or general pediatrics. We're here and would love to have you. Thank you.
Hello, my name is Terrence Pugh, and I'm a physiatrist here at Atrium Health, Carolinas Medical Center within the Department of Physical Medicine and Rehab. We'd like to welcome you to your journey here as a medical student, and I want to tell you a little bit more about the courses that we have to offer here in the Department of PM&R. So within our department, our first course is an Intro to Rehabilitation. So it's our PM&R 479 course. In that rotation, you'll get 1 week on the Pediatric Rehabilitation Service, a 2nd week on the Stroke Rehabilitation Service, a week of Traumatic Brain Injury, and a week of Spinal Cord Injury Medicine. Depending on your interest, you have the opportunity to come back and try another month on the Traumatic Brain Injury rotation, Spinal Cord Injury Service, or Pediatric Rehabilitation. You'll meet with me as the course director twice during your rotation to make sure that you're getting settled in, answer any questions or concerns that you might have, and give you an opportunity to improve as you're going through your rotation. If there's any questions or concerns that come up along the way, please don't hesitate to reach out and contact me. Welcome and good luck.
Hi, I'm Dr. Rodney Villanueva, the Psychiatry Clerkship Director for 3rd and 4th year medical students at Atrium Health Psychiatry. Atrium Health Psychiatry is headquartered at Behavioral Health Charlotte, just a short distance away from Carolinas Medical Center. We offer unique experiences for rotations in psychiatry, which include the region's only 24-hour, 7-day-a-week psychiatric emergency room. Students can choose from rotations in adult and child inpatient, outpatient, community psychiatry, which allows students to choose from any outpatient experience that they want over the course of 4 weeks. We also offer consult liaison psychiatry and, of course, emergency psychiatry. So we hope that you'll choose Atrium Health for your psychiatry experience. We'd love to have you.
Hi, I'm Bob Lopez. I'm a musculoskeletal radiologist at Charlotte Radiology, and I am the director of the radiology elective for medical students. At Charlotte Radiology, we are really excited to have you be with us because a lot of us enjoy teaching, and in the past, a lot of the students have felt this has been a very worthwhile elective. We are subspecialized, so you'll be able to tailor what you want out of the elective. So if you're going into pediatrics, we can give you extra exposure. If you want to do more interventional, we can accommodate that as well. I think that we've all found that this elective has been very instructive to us attendings as well as the students, and you'll also be able to do some procedures as well. So hopefully you'll consider us and get to learn some radiology with us.
Hey team, so come to Carolinas for your emergency ultrasound rotation.
So when you come to the rotation here, we'll teach you all of the tips and tricks to performing and interpreting point-of-care ultrasound. You'll be in the emergency department with a world-renowned ultrasound faculty. You'll do fast exams on the critical trauma patients. You will do cardiac exams on chest pain patients, patients with shortness of breath. You'll evaluate hypotensive patients using the rush exam. You'll also learn how to place ultrasound-guided IVs. During this rotation, you'll participate in weekly image review where we go over the most interesting cases that we've seen through the week, as well as lectures and journal club. So come join us in the emergency department for emergency ultrasound rotation. Thanks.
I am Jay Patel, a current third year and fourth year clerkship director for family medicine at Atrium Health. I think that Charlotte provides a great opportunity for medical students to train, learn, and live. Having been a student here, having worked as a resident, I think this is probably one of the greatest hospital settings to work in. In family medicine, we offer a bunch of courses, both inpatient and outpatient, that give you a good idea of what our population's dealing with in terms of their health care. So we hope you come here. We're super happy to see you next year.
Well, thank you so much for joining us for our virtual course tour today. I am happy to work with any of you while you're here if you have any academic issues or need some career advising.